Are you taking too many medications? Peer into your pillbox. It may be time to streamline your drug regimen. Medication regimens often start simply, perhaps with a multivitamin and a single prescription drug to treat a chronic condition. But with age and more health problems, a regimen may grow to include additional prescription drugs and dietary supplements such as vitamin D and calcium, plus over-the-counter medicines to reduce symptoms such as pain or heartburn. In time, you can find yourself facing a crowded pillbox and a complicated regimen. Among people aged 62 to about 85, a third will take 5 medications per person. In the higher-risk population, people average 15 medications per person. And some of the dialysis patients take about 20 prescriptions. High pill burdens have led to a trend called Deprescribing, a process of eliminating unnecessary medications. There has been a huge push for more patients to cut down on their medications because of the potential downsides. The perils of many pills. It can be a hassle to take even one pill on a regular basis. But the challenge of a large drug regimen goes well beyond inconvenience. As the number of pills you take increases, so do the costs to your insurance and to you. Less obvious are the following potential problems. Side effects. The more medications you take, the more chance there is that you'll experience side effects. Medication errors. It's easier to get confused about which pill you took when, so you may wind up skipping a dose or taking too many. Drug interactions. Particularly if your doctors aren't communicating with each other about what they're prescribing, or if you use several different pharmacies, you run the risk for drug interactions. Drug regimen fatigue. The more complicated a medication schedule is, the more likely it is that someone won't take the pills as prescribed. People may pick and choose what they want to take that day because they get tired of taking pills. That can mean that their disease is not properly treated, and it can produce unnecessary side effects. Quality of life. We've had some people taking medications up to 5 times a day, and they literally feel like their whole life revolves around taking their pills. Rethinking the regimen. If you have a complicated drug regimen that is causing problems like these, you may want to consider downsizing. But don't try to simplify your regimen on your own. That can worsen the control of your condition and increase the risk of side effects. It's best to speak with your doctor or pharmacist about deprescribing. Just be very honest and say you feel like you're taking too many pills, and ask what you can do to reduce your medications. You could schedule a drug checkup and bring all of your medications with you in their original bottles or packages. If a virtual visit is more advisable, be sure your doctor or pharmacist has access, likely through an electronic medical record, to a listing of all of your medicines. And convey your own judgment about how well a particular medicine is working, particularly when you don't think it's helping. When you are advised to start a new medicine, ask for how long you need to take it. People are often started on a proton pump inhibitor such as Prilosec, omeprazole, for heartburn, but it isn't communicated to them how long they should take it, so they take it for years when maybe it should have only been a few months. Stopping a medication. In some instances, it might be safe to eliminate a pill in your regimen abruptly, for example, if you're advised to stop taking an allergy pill or an over-the-counter painkiller like ibuprofen, Advil, Motrin, when you no longer need it. But that's not the case with all medicines. For example, if you stop taking an antidepressant abruptly, you could relapse into depression, or you could experience discontinuation symptoms. These symptoms can include dizziness, loss of coordination, fatigue, tingling, burning, blurred vision, insomnia, nausea, diarrhea, flu-like symptoms, anxiety, or crying spells. During this transition, maintain a pill schedule with a log or chart. Note the medication's time and dose, and check it off when you have taken it. Keep track of any new symptoms during this time. In time, you may find a streamlined regimen winds up being the prescription for a better quality of life. Check with your doctors before you apply any of the suggestions in this program. Thanks for watching.